the BBL, Brazilian butt lift. One of my favorite procedures to perform. If you go to my page, you'll see that I do a lot of fat grafting, including the buttocks. And with the BBL, my approach is always to give you a size and a shape that matches your liking, but it's not exaggerated, it doesn't look abnormal. So when you wear your jeans, your dress, or your bathing suit, you don't raise any eyebrows for the wrong reasons. It looks like it fits you, like it was always meant to be that way. And that is my approach with the BBL. We use fat from areas where you don't need it, and we bring it to the buttocks, giving you the size and shape that you want. Usually the most common shape is what we call the inverted heart. There are other shapes as well, the A frame, the V frame, the apple bottom, but the inverted heart, it's the most commonly asked for. People like that shape, me included, and the goal is to basically do a smooth transition or a harmonious transition between a snatch waist going down beautifully into the buttocks. The most projecting part of the buttocks will be at the center and the bottom of the buttock, both of them. And with the BBL, we have to follow certain rules during the surgery, but immediately after the surgery. You should not sit on your buttocks for 3 weeks. There's a special pillow that we like to call the BBL pillow. Looks like a rectangle, and it has two indentations for your thighs. So when you sit on the chair, you're basically sitting on your thighs and preventing adding too much pressure on your buttocks. This is important to allow the fat to settle and incorporate or take before you can actually start putting pressure on the fat graft. For the liposuction part, it's important to use the right technique so as to protect the fat cells, so they're viable and rich and increases the take of the fat. In our technique here in Jason Emer MD, we use techniques like PRP plasma, you might have heard of it, in order to increase that fat graft viability and survival. That's why we promise our patients excellent fat take in our BBLs.